Now, the Minister for Defense, Dominic Nitiwul, has cautioned the public to desist from acquiring land belonging to the military. According to him, such land, if detected, will be retrieved appropriately. He gave this caution during a tour by his outfit to inspect some ongoing project at the Burma camp in Accra. JoyNews' Tasha Michelle was on the tour and filed this report.
The Ghana Armed Forces is undergoing a major facelift to meet a modern military standard. During a tour at the Burma camp in Accra to inspect some ongoing projects, the Minister for Defense, Dominic Nitiwul, said the public should desist from acquiring lands belonging to the military.
I want to appeal to especially members of the public to stop the idea of thinking that they will get lands that have been allocated to the military. I want to assure you that any land that has been allocated to the military and it's actually land that has been legally acquired is for a purpose. If we had decided to give out this land some time ago, we will not be having this land today to give 48 accommodation here and 8 in Burma camp to our generals. I want to appeal to the people of Ghana that if anybody is telling you that there's a land that you can buy that the military are sitting on, it won't happen under this administration. If it's a mistake, the Lands Commission sells that building to you, we will take it back and use it to develop for the members of the Ghana Armed Forces. There are a lot of members of the Ghana Armed Forces that do not have accommodation. So we cannot keep giving land that government acquired in the colonial times to people to build private homes. We can all go outside Accra and build if we want to.
The minister was also happy with the progress of work and urged successive governments to continue work with development projects.
We need the support of the people of Ghana to continue this. And also to appeal that any government, whether an MPP government or a future government, should continue these projects. We cannot start like this on this massive scale and slow down. It's a duty of us to house the members of the armed forces.
Mr. Nitiwul also acknowledged the efforts of the Chief of Defense Staff in executing projects without financial support from the government.
Huge projects. This is self-funded. They already have one in Takoradi. There's one in Tamale. I've just approved, he brought for my approval to do 8 more across the entire country. So I want to commend the Air Force and the Air Force staff. When you go to Bondasi, you go to Sunyani, even Accra, you see what the Army is also doing. Same thing with Navy. If this is what the Air Force is doing, the Army is doing same, the Navy is doing same. All of us, we must all commend them and do same.
According to the Deputy Director for Engineering Services, Lieutenant Colonel Albert Techi, the construction of warehouses at the camp will be one of the biggest warehouses in the Ghana Armed Forces.
As part of keeping stock of items in the warehouse, the stores are supposed to be, they're also supposed to do that to check the items. Then the same warehouse is also at the far end here, which also has the same capacity. Then we have a longer one, 78 meters long. We call it a 2-bay twin warehousing capacity. The whole idea of this is to keep our staff and our equipment according to how military stores a thing. So from spare parts to weapons, everything will be stored here. Yes, in Ghana Forces now, this will be the biggest warehouses that we ever have. Looking at the projection of the armed forces in the next 4 to 5 years and beyond.
The military is also undertaking projects in garrisons across the country. Tasha Michelle's report for JoyNews.
Now, frustrated, worn out and depressed. These were the expressions on the face of Rose Edujemfi, a nursing assistant who has remained unemployed since graduating from training school. Her planned life after school has not materialized because she has not been posted since then. Rose, a member of the 2019 batch of the Registered Nurse Assistant Clinicals and Preventives, reveals to JoyNews how her life has been unbearable for her and her friends since leaving school 3 years ago. Speaking to me after the association called off an intended demonstration which was scheduled for Wednesday, 20th July, over non-posting, Rose Edujemfi begged the Ministry of Health to post them.
My uncle, thank you very much for this question. Life isn't easy. I am a mother of 2. In fact, we the nurse and naps, some people regard us regard us as being down. No. No. We went for the training for 2 years. We have our job description or our limitations. When you come to the ward, we do most of the jobs. But where are we now? I have completed school for 3 good years now. I am still in the house. How do I survive? I have to go and tell them. I'm not saying, I'm not denying the fact that our mothers or like the businesses that they are doing in the market is boring or poor. No. But as a mother of 2, when I was giving birth, I had this problem at my lumbar area and my waist. I had to stand on my feet every day. And after I've received something to eat, I have to use this same money to go and cure my sickness. It's not easy. It's not easy because of the birth defect when I was giving birth. It's not easy. It's not easy at all. My child will ask me, Mom, have you stopped the nursing? Because the child has witnessed that I've not been wearing the uniform again. Why? Because I've not been posted. In fact, life is not easy. No amount of words and no amount of words can explain and express the hardship. The hardship we are going through is not easy. It's not easy. We can't. They have given us clearance together with the diplomas and then the degrees. Where are they now? They are at post. They are doing their work. They did their service. We don't do any service. Instead of the government to post us, they will say today, tomorrow, today, tomorrow. So what should we do? When you go to the private sectors, they will tell you you are having clearance. So there is no need to admit you or give you admission. They can't absorb us into their system. They can't. They can't. So how are we going to feed ourselves and our children? It's not easy. It's not easy.
Now, the Ghana Registered Nurses and Midwives Association has waded into the issue of non-posting of already registered nurse assistant clinicals and nurse assistant preventive. Joining us for more on this is the General Secretary of the association, David Tinkrine. Sir, thank you so much for joining us. Why are these nurses not posted, though they claim financial clearance have been approved?
Good afternoon, my brother. Thank you for having me. It's a problem. That question can best be answered by government. I reckon that this government has done quite well when they assume office. They've been able to give us about 5 successive financial clearances that were able to clear quite a number of backlogs that we had in the system. But they've not succeeded in continuing that process. And this time around, we have some more backlogs. Now, these category of nurses that we are talking about actually completed school in 2019. And because they are certificate nurses, they don't do internship. So as soon as they finish, they are supposed to be posted, all right, or absorbed into the system. And few of them were referred. Quite a number of them were referred, and they've been able to make the appropriate grades and are waiting for employment. About 10,000 to 727 actually filled the portal. The portal was open for them. That is why the young lady said that they open a portal for them and the diploma and the degree holders. But I can't just understand why the NAC and NAC batch of the 2019, including the referrals, have not been employed. And these are some of the challenges that we are facing. And it's not that we just waded in. We've been pursuing this from time to time. As soon as our people complete school, we make sure that they are enrolled on the National Service Scheme. And immediately after National Service Scheme, we impress on the ministry to forward their names to Ministry of Finance for financial clearance. So we've been working collaboratively with the director of Ministry of Health, Human Resource at the Ministry of Health to, get solutions to some of the problem. But lately, it's been a bit difficult. So if you ask, this is what I know.
Well, if a portal was open and they all were able to register, why have you been able to find out from the government, the Ministry of Health, why this batch have not been posted for them to also start working?
We did just that. And mostly when we go with their leaders. So they are very much privy to the whole situation.
Okay.
When a portal is open and the people fill in the portal, it is then left to the agencies under the ministry to employ. Don't forget that we have several agencies at the ministry. The biggest of them is Ghana Health Service. So we expect that truly, if a portal is open, and we don't expect the portal to be open when financial clearance has not been released. So we anticipate that, of course, the financial clearance was released before that portal was open. So if the portal was open to them, then it stands to reason that immediately after that exercise, they ought to be posted by the various agencies.
So what did the ministry tell you as to the reason why these people, though have been able to fill their forms on the portal, are still in the homes?
Like what the lady said, anytime that you go about one word or the other, they keep reassuring us that they will employ them. That is why we have decided to issue a statement now, because we're trying to use dialogue to be able to resolve the concerns of our younger colleagues. It's not easy for them. I mean, you can see the desperation in their eyes, and we are not happy at all. As a matter of fact, we don't even want our people to move onto the street because it demeans the profession. That is why this administration has been very proactive in working with government to secure quick financial clearances for them. But for the past 1 or 2 years, things have been a bit difficult, and we ask government to do the needful so that we can move on with our life.
What is the nurse-patient ratio now? What should be the ideal?
Well, it depends on the jurisdiction, but of course, we have nurse population ratio and nurse patient ratio. We have nurse patient ratio. I remember the Minister for Health was talking about the fact that Ghana has achieved nurse patient ratio, but we need to interrogate that because there are various professionals. Okay, when it comes to the nursing profession, we have professionals, we have auxiliary grade, and we need to have a certain balance. We need to have 60% professionals and 40% auxiliary. As we speak in Ghana, it's the other way around. So I even don't understand why the minister came out to say that we have met the WHO's recommendation of a nurse population or nurse patient ratio. As far as the right skill mix is concerned, we are not there yet.
Okay. Hold on for me. Let's take a look at the statement your association released on Wednesday about this same development. Now, according to the statement, now there's delay in the payment of trainee allowances of up to 11 months. So the allowances that are supposed to be given to the trainees are still in some arrears of 11 months. There's also delay in the posting of nurse assistant clinical and nurse assistant preventive belonging to the 2019 batch who have already been registered on the Ministry of Health recruitment portal. According to the statement, there are other things that need to be looked at. Now, these are two of them. Now, one thing they also state is that delay in the issuance of clearance for permanent recruitment of the nurse degree referred group who completed the 2019 national service or completed their national service in all rotation in September 2021. There's also delay in that. And again, they say that there's delay in the issuance of financial clearance for the permanent recruitment of the 2020 NAC and NAP, and these are nurse assistant clinical and nurse assistant preventive. Point 5, they say, and they bring in recommendations as to how this issue can be dealt with. One, we admonish all nurses and midwives awaiting employment by government to trust their group leaders and accept in good faith the periodic update they relay to them from our engagement with the Ministries of Health and Finance, and desist from any act that will affect the image of the nursing and midwifery professions in Ghana negatively. 2, we want all of you to remember this quote in our pledge, and I quote, "I promise that my personal life shall at all times bring credit to my profession." We wish to state emphatically that Miss Lydia Amankwa's choice of sleeping with multiple men to survive is a choice, and does not reflect in any way the nature or attitude of our younger colleagues or generality of nurses and midwives in Ghana. 3, as part of the recommendation, we need a regulator of the nursing and midwifery professions in Ghana, that is the Nursing and Midwifery Council of Ghana, to take disciplinary actions against these individuals who resort to social media to dent the image of the profession. 4, on our part as a professional nursing and midwifery association and a trade union, we are going to enforce our recently developed disciplinary code of conduct to ensure that members of the association project a good image of nursing and midwifery, and to desist from unnecessary social media posts whilst in their uniforms. That makes the point 4 of the recommendations. Now, so General Secretary, when the people are thinking about how to survive, how can the association then be thinking about professional conduct? These are people who are going hungry every day. Kindly unmute for me so we can hear what you're telling us.
All right, thank you once again. I agree with you, and we sympathize with our people. That is why, as the trade union holding the collective bargaining certificate, we are not sleeping on our house, but we are taking the matter up with government. So we expect our junior colleagues to respect the solution that we want to prefer. Now, no amount of frustration should get a professional nurse to voice out such disdainful statement. I mean, to say that I virtually go by sleeping with multiple men is unacceptable, and we want to, distance ourselves from such things.
Well, she didn't say the association. She said
I can tell you that
and
99.99%.
No, but Mr. Chung, she is talking about her reality, not the association's reality. And how long can they hold on without being posted?
I'm saying that we sympathize with them. And on countless basis, we have visited the ministry with their leaders.
Okay.
So it's not like the association is keeping quiet. But what I want to reiterate, and I want to emphasize, is that under no circumstance must a professional nurse put out such a statement. I'm saying that she was wearing uniform. The uniform doesn't belong to her. It belongs to the profession that she has joined. Okay. The fact that she used her money to buy that uniform doesn't mean that she can conduct herself in any way. So what I'm saying is that
Mr. David, I'm grateful that you could find time to join us here on our news. You've really helped us to explain issues. Grateful to you. Managers of the COVID-19 National Trust Fund are expected to account for the monies received and spent. Let's go live to the Ministry of Information, where the chair of the fund, Her Ladyship Justice Retired Sophia Akufo, is undertaking the exercise.
In my fundraising mode, anyone who's still willing to help, because the COVID-19 is still around, the money comes to they can pay the money to our account at Bank of Ghana, or come to the office of the COVID-19 National Trust Fund. And even though it says to receive other monies or resources contributed or donated, we haven't yet received any such other monies. Our monies come from voluntary sources only. Now, the mandate, and that is our legal jurisdiction, is to complement the efforts of the government in fighting the pandemic, and to support needy and vulnerable persons who were infected or have been affected, because those are two different states of being by the COVID-19 pandemic. And then to also support individuals and institutions who have been engaged in the combat against the pandemic. And any other matter, we haven't yet done any other matters. So, for example, the institutions engaged in the combat, we have been supporting, on and off, we've been supporting, for example, the Noguchi Institute. We have been supporting various health centers, and there have been times when we have supported health centers which are not necessarily in the public sector, but in the heat of things, they had also become treatment centers receiving people who had been infected. Now, the Board of Trustees is made up of myself, Archbishop Akrofi, Mrs. Elsie Awadzi, Mr. Jude Buckner, Mrs. Gifty Afeni Dazi, whom I think she's very much one of you. I always see her as an embodiment of journalism in this country. Dr. Ernest Ufuri Sapong, Dr. Abdul Samid Tanko, a cardiologist at Kolebu, and Dr. Collins Asari, who's our administrator. So this is us, what we have been set up to do, and this is how we do it. And we have been receiving cash donations, cash stroke check, hardly cash, because we don't encourage that. Rather, what has been happening is that people go and pay into our account our account, we have only one account really. Our account is with Bank of Ghana. And Bank of Ghana has appointed CBG and GCB and Consolidated Bank and Commercial Bank. They have been appointed the agents, the receiving agents for Bank of Ghana. So, because they have nationwide coverage, and so monies are paid there into our account. And so most of the time when people would see all those ceremonies, the money has already been paid, and then we're just going through the action. And so as at 30th June 2022, and that was the height of things, we had actually collected, or we had received 62.329,941 cedis, 98 pesos. Never forget the pesos, they add up. And particularly at the heat of matters, we had also received a whole range of in-kind donations, sanitizers, cleansers, cleansing equipment, various types of dry foods, drinks, you name it. We received rice, pasta, and so on and so forth. And then quite a number of vehicles. We received quite a number of vehicles. And this sets out the various types of in-kind gifts that we received, even fuel coupons and so on and so forth. And some of the use to which we put the fuel coupons were that when we made donations and the organization to which the donation is being made, the hospital, the testing center or whatever, if they had to come in from out of town, we helped them with their transportation, with the giving them some of the coupons. And I think for us ourselves, no, we did not give ourselves any of the coupons, and unless we're going on official assignments. So the donations we made donations to the Noguchi Institute. I've mentioned the Noguchi Institute. We made donations to the various COVID-19 care management centers in the heat of things that were set up. But as time went on, we realized that, yes, these care centers are there, but there are other health facilities where that's where the person was diagnosed to have COVID-19. As to how they were going to be treated and how they were going to be handled, you needed also to make donations to such places so that right from the start, you're protecting the medical staff and you're also protecting the users of the hospitals, clinics, and so on and so forth. So in the end, we made distributions, particularly of PPEs and sanitization materials and all those essential things to so many different institutions, including going to what I considered the real front line, which was the CHIPS compounds. Because when somebody had fever or couldn't breathe and was sent to a CHIPS compound, there had to be protection there as well. So the vehicles, we donated them to hospitals, care centers, testing centers, and so on and so forth. There was an ambulance which we donated to Ga East, which was one of the really busy centers because of its location. And later on, when the infectious diseases center was also completed, we've been helping out as required. But really, across the nation, we did distribute these vehicles as needed. And for ourselves, I think, we used one briefly and then gave it away to the NCC, who were doing who also started helping us with the education aspect of the work we do. So the vehicle so we had some in Chenchema we were using for a very long time till we finally we bought ourselves 3 vehicles, which are duty vehicles, particularly for work outside the city. Because, for example, right now, Peter is overseeing a project that we are doing in Cape Coast, for the Cape Coast region, the Cape Coast Teaching Hospital. We're helping to rehabilitate a building for COVID and also for infectious diseases, and so that's what we do. So all the details are there, and I'm not going to read all those details; it will be too boring. But everyone who wants what we're doing, everything on pen drive, they'll provide. If you bring your pen drive, they'll give you the information. I had hoped we could get it done real high tech and put that thing, what's it called? That code, QR code, Oh, they've QR coded. Okay, so there's a QR code somewhere. So those of you who know about those things, I learned about that only last week. I'm 72, going 73, so I'm excused. Yeah. So you can have it, because as for information, the more you have, the more enlightened you become, and the more discerning you become. And so, as at 30th June 2022, the amount that we have spent on various things, the total amount we have spent, including even administrative costs, is 53,230,805 cedis and 37 pesos. And then we really go through details as to what activities these were spent on. I will only highlight some, because some, not even all of them are here, because this morning I even remembered that some of those that we did have not been captured here. But in terms of me, I like to go into tiny little details, but the basic ones, yes. One of the most important ones that we did, because we had just been set up, we were a new institution, we were coming into being, and yet we had to be in a position to be helping out, to be carrying out our responsibilities. So we needed to procure protective PPEs. This was in the heat of things. And they were not available to be bought off the shelf. And in any case, there was the Procurement Act and this and that. Even getting ourselves registered as procurement entity took forever. If you take the relative period of time we were in. So the board took the decision that since there was we needed these things urgently, we would use the auspices of the private. There was also a private sector COVID-19 fund that was set up by people from the private sector for their own operations. So we asked them to function as our agents under an agreement. And so they purchased on our behalf and delivered to us. In fact, when the delivery was being made, even where to store was a problem. So we had to fall on the military and use some of their storage spaces. We used storage spaces at the State House and so on and so forth. But we never lost control of our own things because we were counting every single item. And so between April and December, we were able to distribute about 10.25 million cedi worth of PPEs and other materials. When we say PPEs, it's not just this, but it's the gloves and the face shields and so on and so forth. And so we were able to do this across the country. 8 testing centers, 9, all the regional and municipal district hospitals, etc., and 126 CHIPS compounds. We were able to do all that. And then we then found out that the body, our private, that private cousin, they're not our sisters. It's not a sister body. It's a cousin. They were in the middle of also building an infectious diseases center for Accra. So and it was, they had decided that as soon as they were ready, in fact, they were planning to finish within a matter of a matter of 3 months, so that they could be taking in the COVID-19 patients. In the end, it took a little bit longer than that, but by June, was it June? Doctor? July, yes, they had finished. So they at a certain point in time, they had they were short of money to be able to complete. And so we donated 6.8 million cedis to them, and it was completed, and they were able to complete and open. And so many people's lives have been saved in that center. And it's state of the art. And any of you who passes by, please go there and take a look at the way infectious diseases centers ought to look in this country, so that people will be amenable, because really we need more than one of that sort. We need one in each region. So this one is sited next door to the Ga East Medical Center. And so, well, I like to say that they've named the lab and one of the wards after the COVID-19 National Trust Fund, because time will come when we will be just history. And so they will know that once upon a time there was a COVID-19 virus which did horrible things, and there was a trust fund, and they made contributions to that center. Another one that I really feel very proud of was when we were suddenly informed by the Ghana Health Services about the shortage of reagents with which to do the testing even at the main testing centers. And so we were able to meet and decide that, yes, okay, we will. This is support. This comes under supporting the persons and institutions engaged in the combat against the COVID-19 pandemic. So we made donations in that regard. 5.5 to Noguchi, 1.9 to the vet services. And some of you may wonder why vet services, were the animals also catching COVID-19? No, they weren't. That was the question I first asked, till I found out that was also a testing center. It's a very important testing center, especially in other parts of the country. So we gave them something. And then another one that we did was we were approached. Normally, we are approached, then we study the request, and then decide on whether we will or we will not. So it's not every application that gets granted. But sometimes too, we see a need, and then we ask them, do you need us? And if they do, then we formalize a relationship and see what we can do. So we sent 8 million cedis to support they wanted much more than that, but we've always been very, I won't say parsimonious, we've been taking care of the money in a very Presbyterian sort of manner. So we gave 8 million cedis to the reopening of educational institutions coordinating committee to purchase PPEs and sanitizing items and gels and things like that to enable the reopening of the tertiary institutions. And what you must note is that when we give these donations, in most cases, we agree that for your activity, this is how much we're giving you. But then we need to deal directly with your suppliers. You procure your suppliers, and then we pay the suppliers. So these monies went to, they were making cloth masks, reusable masks mostly, but we also some of the disposable ones. But for example, we got copies of invoices from GTP, from ATL, because they're making the cloth, and then invoices from the sewing company and things like that. That is how we do our thing. And throughout, we were also concerned about ensuring that public education, public awareness is at the proper level, and so from time to time, we would team up with a body that we think is effective in public communication. The NCCE was the first one that we dealt with, because they also have offices in every district and so on and so forth. So they had offices in districts, but to move and to be able to be heard was part of their problem. So we gave them quite a sizable contribution, which enabled them to rehabilitate some of their vehicles and equipment, and we actually also gave them some vehicles to enable them go into the hinterlands and wherever it was needed to give out the message about masking. At that time, it was the masking and the distancing and the sanitization of hands that was most crucially important, because the vaccine had not come in yet. By the time the vaccines came in, we had also teamed up with the National Commission on Culture, and we enabled them to mount so many puppet shows in public places like lorry stations and markets and school parks across the country to educate people on the whole gamut of the protocols, including vaccination. And Ingenious Africa, which is a production company, we teamed up with them for more educational materials on TV. And so they had a series called Corona Life, which deals with so many aspects of the pandemic in interesting ways that will capture the imagination and stick the message in your head. And our surveys show that the impact has been very, very good. Particularly also the impact that the National Commission on Culture made was so good that we did, I think, 3 series with them. And the feedback has been good. We've also teamed up with the National Road Safety Committee and Authority, and that one is on an ongoing basis. And so they mount their programs from time to time, and then we make our contributions of items. It's mostly of items, sanitizers for the vehicles and masks and so on and so forth. And For me, one of the most significant contributions that we did make, that one we made it last year, was paying for the laying of pipeline to connect the, I still call it Ridge Hospital, Greater Accra Regional Hospital, Ridge Hospital, to some of us. Yes, it had been renovated to very modern standards, the main part, and it had its own, and it does have its own oxygen production facility. But unfortunately, that facility was not connected. It was connected to the new building, but it's not connected to the older parts of the hospital, which is where the COVID-19 center was. And who needed more oxygen than them at that time?
You're still watching the news desk on the JoyNews channel. We'll take a quick break. When we return, we'll bring you latest from the world of business. Stay with us.
Hi, good morning. Welcome to Business. My name is Darryl Kwao. The Board of Directors of the African Development Fund has approved an $11 million package to support the Permanent Secretariat of the African Continental Free Trade Area to help enhance its effective implementation. The package from the bank is expected to help with integration activities undertaken by the Secretariat to ensure smooth implementation of the agreement. Here's more in this report.
The African Continental Free Trade Area Secretariat opened its doors in Accra on August 17, 2020, with initial support of $5 million to set it up, as well as supporting its programs and providing tools to raise stakeholder awareness. The world's second largest free trade area has a potential market of 1.2 billion consumers, but Africa has the world's lowest level of intra-regional trade at less than 18%, compared with 22%, 50% and 70% for Latin America, Asia and Europe respectively. The AFCFTA aims to increase theirs by up to $35 billion per year over a decade, lower annual imports by $10 billion and boost agriculture and industrial exports by up to $45 billion and $21 billion. This second phase of support continues to aim to encourage sustainable intra-African trade and to increase the share of African countries participating in it. It is also intended to move the African trade integration agenda forward by enabling the Secretariat and the countries of zone, especially transition countries, to harmonize and integrate national and regional trade policy initiatives. The support will be structured under three components: institutional strengthening of the AFTA Secretariat, private sector support to implement the AFTA, and support of climate-resilient regional and continental value chains to boost intra-African trade.
Now, in a quest to rebuild sustainable entrepreneurial ecosystem post-COVID-19, Aspen Network of Development Entrepreneurs has organized a West Africa Regional Conference to address challenges faced by small and growing businesses. Here's more in this report.
The aim of the conference is to provide a platform for ANDE members across the region to interact and focus on solutions to the most pressing challenges faced by small and growing businesses. Speaking to Joy Business, Deputy Chief Executive of Development Bank Ghana, Michael Mensah-Ba, indicated that his outfit is putting together an intervention program for young entrepreneurs.
At the moment, we are putting together our strong governance structures and preparedness for beginning to give out our first loans. However, we have also formed partnerships, and some of the key partnerships were formed with the Ghana Enterprise Agency, the Association of the AGI, and the Ghana National Chamber of Commerce and Industries. These are a few of the partnerships that we formed, and we want to work with them to ensure we also understand the challenges that the SMEs face, so that our products that we'll design will actually be tailored in a way that supports the growth of these SMEs.
On his part, member of the Enterprise Development Center of Pan-Atlantic University, Peter Bamkole, advised young entrepreneurs to leverage technology to expand their business.
You see, whether we like it or not, SMEs, SGBs, they must begin to begin to adopt technology or digitalization of their processes from when from your supply end to the delivery and after sales service. And what we have seen during COVID was that majority of the small businesses that grew during COVID, that thrived during COVID, were those that leverage on technology. And we had a survey that we did mid-COVID, and about 7% of those they actually thrive.
Managing Director of Venture Capital Trust Fund, Hamdia Ismaila, touching on the lack of finance for SDGs, said entrepreneurs must resort to the right financial institutions to get support.
I think one of the difficulties we have in Ghana is that people, especially entrepreneurs, chase monies that is not right for them. Right. So, for example, if you are now starting, banking is not a place for you to go. The bank wants to see that you are actually selling, you are making money, you have cash flow. So when they give you money, you can pay back. So when you hear that, we are not able to have access to funding, it's because you are going to the wrong type of financing.
Andy is a global network of organizations that propel entrepreneurship in developing countries.
And that's all for business. Back to you, Brace.
And that's all for the bulletin. There's more on myjoyonline.com. Good morning.